Welcome, everybody. This is the talk of Stephan, Health Promotion Responses to the COVID-19 Pandemic. Fake news, understanding complex issues, health knowledge. How can we develop the capacity of each individual to take charge of their own health?
So this is a question that I really like to answer to, because it links up with one of the keywords, I think, in health promotion these days, which is health literacy. I think it's important, of course, that in order to take up measures and to take control of their lives, people must be well informed. And I think that goes not only about taking preventive measures, but also the whole picture, how to deal with the situation. Now, the issue is that as with other health problems and health situations as well, with respect to COVID-19, there's a bombardment of information. There's far too much information available. And when you put on the news, there's COVID. When you talk to people, there's COVID. So it comes from all sides. And of course, this is not helpful in itself. We need information, but we need the right information. So the challenge is not to add more information. I think what we now have to do is to make sure that people have the skills and the capacities to get access to the information they need, and that gives answer to their questions. So that means that the information has to be accurate and reliable, which is basically almost the definition of health literacy. So the capacity of people to not only get access to information, but also to understand it and to really make the difference between reliable and unreliable information. So if we translate to the COVID-19 situation, I think we need to make sure in the information that we, and I mean the health authorities in this case, put at the disposal of the people and the population, we have to make sure that the information is understandable, that the information is transparent, and that it is consistent. So that even people who don't have a degree in public health understand what it means to keep social distance, that people know what risks are, and that we avoid the problem of either underestimating or overestimating. I think also repetition is important. We know from health literacy research that explaining something in easy terminology, but also repeating will certainly help. And we should not be afraid to correct information, because what you often hear is, the experts now, they say one thing, then they say the other thing. Now, face masks used to be unimportant. Now they are important. I think we should not be afraid to change if we need to change the information, if we have more insight. But I think we should, of course, be consequent and consistent in the way in which we answer the questions of the people. And what we certainly should not do is to play the game of accusing people and seeking scapegoats and blaming. I think we should strengthen the capacity of people to be well informed. And if you go to the next slide of that, I think if we really want to understand what makes people act on health information, I think we should really also consider the cognitive processes behind it. Information handling is not something where somebody passively receives information and acts accordingly. It is a very active process. And so even in the sources of information and the type of information we take from those sources, we are very selective. All of us are. So the situation in which we live, the people that we interact with, all the emotions that we have, they influence the way in which we look for information and the kind of information that we take in or not. So we have to be aware that there's a lot of information bias, and not only in seeking information, but also in processing that information. When we try to understand and when we try to judge whether certain information is relevant or not and is useful or not for us, I think, again, we apply certain cognitive mechanisms. We compare with what we already know, for example, or we compare also the different sources that we can access. And for example, there's among many people the tendency to attach more importance to negative information than to positive information. So that in itself introduces a bias. The opposite exists just as well, not necessarily in the same people, but they can coexist. And so also the fact that we tend to act more on recent information than on information that has a little bit longer, that's been there for a little bit longer. So I think trying to understand the mechanisms behind how information is taken in and processed, I think is very important. And this is certainly important in the next slide then. If we look at the way in which the news about COVID is being driven, we notice that there's quite a lot that is not really reliable. So not only do we have too much information, a lot of it is actually totally unreliable. And this really is very noticeable in the so-called myths about COVID-19, which are abound. And even high-profile people are victim to the myths and believe myths and reinforce the myths. So, for example, the fact that it's made or maybe escaped out of a laboratory somewhere in China, for example, or also with regard to ways to protect. So there are a lot of totally unsubstantiated facts or rumors that can start living a life on their own. Now, this wouldn't be so bad if we would all consult the same sources of information, but that's not necessarily the case. And false beliefs about the coronavirus and COVID-19 are reinforced by the fact that we often rely on specific sources of information and close our eyes and ears for information that doesn't confirm them. This is what we call echo chamber or illusion of truth effects, where we basically just hear the same things, and because we always hear the same things, we think they're true. So I think there's an important task also to try and battle that. I think we should really emphasize the need for people to counter-check, to not just take information as it comes, but really counter-check, to look at which sources are actually being used to get that information from. There's a number of specific tasks we can do there, or tricks we can, for example, ask who is behind the information, what's the intention. So just a number of basic questions, but they are very helpful. Certainly also try to verify by comparing to other sources. And last but certainly not least, ask people to not share information unless they're sure that it is worthwhile listening to. So I think there's a lot we need to do about the fake news industry in regards to COVID-19. So
Thank you very much, Stephan. Very, very interesting and relevant. And during your talk and answering this question, one of the participants said that there is not enough participation in the formative stages of health information. How to involve vulnerable populations. And one aspect that I also thought when you were speaking is, for example, in my country, the Netherlands, there are 16% of our population has difficulty or is not able to read. And I read a lot about the complexity of the messages and the fact, for example, that when our government presented measures, they have a lot of letters behind them. And for somebody who has difficulty reading, it's impossible. It's really distracting.
I think indeed we should apply here, and I think not just the health people and the health specialists and health promotion specialists, but also governments that are trying to come to grips with the epidemic. I think we should learn from what is already implemented with regard to health literacy in the healthcare sector more and more, which is not as much implemented when it comes to this new epidemic. So really make sure that information is very accessible. I think you named the experience in the Netherlands, but I can also name one of the positive things in Belgium, for example, in the beginning of the epidemic. There was one slogan that is "Stay at home," and that's what people understand.
Yeah.
And so it doesn't mean that you put down the people's intelligence when you use simple slogans and simple instructions. Mm-hmm. It's actually helpful for everyone, also people who are highly intelligent. Confusion never really works. And in crisis situation, you don't need to be so subtle. You need to be clear, and you have to be consistent in what you say.
Yeah.